Good morning, Fairfield and Jefferson County. Thank you again for tuning in and listening to our update. I'm Connie Boyer, and just from the city side, just one small update. Just so you know, we are now rotating our employees in different departments so that they're not all in at the same time. So that's helping us protect our families and our employees. On gown production, I want to say a big thank you to Creative Edge. They've cut all the gowns that a material that we have had. We had a big donation yesterday of material that we took right out there, and they've cut them all. And this was our first prototype, just so you can see. And very proud of it. We think it's going to be great, and we think we're going to have the most colorful healthcare workers in the state. We know we have gotten some donations in to Sacred Son Ministries. If you want to donate cash, you're able to do that. That should go to Sacred Son Ministries, 2851 Glasgow Road, Fairfield, Iowa, 52556. So we will be buying additional material for gowns and face masks. Regarding the gowns that have been cut, they are now being delivered in the next hour to public health. So all our rock star sewers can go pick gowns up and get them sewn together and then deliver them back to public health. We have some instructions. They're very simple, and if you're a sewer, you'll know what to do anyway. So they are ready, and you can pick them up again even this afternoon at public health. So now I'm going to turn it over to Chris.
Hi, good morning. I guess it's still morning. So I'm Chris Estle. I'm the Public Health Administrator for Jefferson County. Just a couple things I want to touch on right quick, and then I'll turn it over to Brett Ferrell, our Emergency Management Coordinator. We have been participating in weekly Iowa Department of Public Health webinars, and we share that link out to our community partners that provide direct service to residents or clients in Jefferson County. Also share that information with our elected officials. And then after that webinar, usually we have a community Zoom meeting, although we're going to change the time because Brett's got another meeting at the same time, so sometimes it gets kind of challenging to try to coordinate all the meetings, but we're going to have a community partner Zoom meeting held on Thursdays. I want to say a big shout out to all of our long-term care facilities. I know you guys have been watching the news and understanding that this COVID-19 has hit the long-term care departments, residents, very, very hard. It's impacted huge numbers. Right now, there's 9 long-term care facilities in Iowa that are considered outbreak facilities, meaning they have more than 3 confirmed positive cases of COVID-19, either in their residents or in their staff members. Again, we ask that everyone practice social distancing, perform good hand hygiene, those kinds of things that you've heard me say for many, many months now, since really the end of January. I know it's frustrating right now for individuals to feel like we are in a holding pattern, because it's like when you look at the numbers of confirmed cases in Jefferson County, we are at 4 laboratory confirmed cases. That's awesome. That's amazing. That just shows that we are doing a great job with some mitigation. However, that might not be a true picture of the amount of illness that we could see circulating or the asymptomatic individuals that may be sharing COVID-19 in our community. Connie referenced the gowns. We're going to be working with distributing that material because it's easy access. People can come in and our staff can help coordinate that. We have been working with masks, with the cloth masks that have been manufactured by great community members. Tammy, Marilyn, Laura Van Zee in our department have been really facilitating that with our local entities and trying to get the direct care workers protected with that first round of masks, and then we're going to try and offer them a second round of cloth masks, because we know as this progresses, PPE or personal protective equipment is going to be in short supply. I wanted to share just a little information. I know that the governor just got done speaking just a little bit ago. There's been some significant changes with other regions. Just so you know, Jefferson County is in Service Area Region 5. I want to direct everybody to the new website or dashboard at the state. It's coronavirus.iowa.gov, and I think Jason's going to share that information. It's got great up-to-date information, the numbers of tested positive cases, the number of deaths, and you can click on your county and you can see that up-to-date information. I will say that I've reached out to our public health administrator in Washington County, and they're dealing with a lot of confirmed cases right now, and they have a nursing home in Washington County that has 25 confirmed staff members or residents, and that is the McCready home. And I will say that I am appreciative of the fact that the governor is releasing the information of the care facilities. So they are naming them by name, which is actually a good thing. So it kind of brings an awareness and a realness to what's going on in our communities. Let's see. One other thing, Chris always seems like she's the negative one when she gets up here and talks, and I try to not be negative, but I try to bring a realness to what we're seeing and what we're saying, and how we can better prepare the residents of our community. I have a note written down here. It says big picture activities and community. And the note that I put beside it is be prepared for disappointment. And I know that with our seniors in high school, they have undergone a huge amount of disappointment. Senior proms, graduations, we have Mother's Day coming up, we just had Easter. Those things are real and they impact all of us differently. So it's a very trying time, and I understand that, but we just need you to hunker down just a little bit longer. Could be another month, it could be 2 months, we don't know. The virus is in charge of what the virus is going to do. We can only try to mitigate it the best that we can. So thank you for all you're doing for that. Let's see. Brett and I have been doing this since January, so we're just a little, are we tired? Maybe, maybe. But thank you to everybody for the hard work that you're doing. I'll turn over to Brett. Hey, we're going to have some snow, right? Yeah. In April.
Brett Ferrell, Jefferson County Emergency Management. First, I'd like to just start off by thanking the citizens of Jefferson County for continuing to follow the guidelines on social distancing. That is important. It's very important. It's the most important thing we can do. It is important that we continue to follow the guidelines that are out until those change. And I think this county's done a remarkable job with our citizens and everybody involved with getting the information out and doing what they're supposed to be. We can do better, but overall, I think these are definitely working in our county right now. Also, like to thank everyone, including local businesses, that donated PPE for us. We've gotten gloves, some face shields, some safety glasses, masks, and stuff like that that have been donated. Every little bit helps, as we know the PPE supply is just going to get more difficult to get, and so we greatly appreciate everybody helping. Our EOC, Emergency Operations Center, continues to be open and very active, and we are involved with virtual meetings, conferences, and planning sessions daily so we can stay on top of current guidelines and information, and then communicate that information out to you guys and everybody here. A lot of that information comes from Homeland Security, Emergency Management, and Iowa Department of Public Health, and then others, the CDC, and things like that. I know we're grateful that we have a passionate community that we live in, and we have a lot of people stepping up wanting to help, and we thank you for that. One of the things we're working on now, we're currently working through some details of the loan processes, such as the Public Assistance Grant Program through FEMA and some other ones. And there's a lot of stuff involved with that. Once we get the details worked out, we'll definitely pass that information on. Emergency Management continues to work with the care facilities, JCHC, and all the others in securing the PPE that we need. And there's been some slight changes to how we order that PPE. We have not ordered any this week because we are, according to the hospital especially, they are sitting good right now. Everybody's curious about personal protective equipment, and it is very important. It's very important that we get what we need, and we've done a good job in that, making sure we get it out to all the frontline workers out there who are just incredible people, and we want to make sure they're protected, and that is our number one goal. Just switching gears a little bit, emergency management's involved in a lot of different stuff. COVID is a daily, hourly thing for us now, but there's other things going on in the world, and I just want to let everybody know that if you haven't heard, Iowa weather's great, and we are currently under a winter storm warning for tonight till 7 o'clock tomorrow morning with potential 6 to 10 inches of snow. So be prepared for that. I know that I didn't want to get that news either, but we'll have to deal with that when it comes. So again, I want to thank everybody for doing what they're supposed to be doing.
Hello, I'm Bryan Hunger, the CEO of Jefferson County Health Center. We really appreciate everyone with community's support and local business support also. We've had a great outpouring of offerings in a variety of different donations, whether it's PPE or other items, and we really appreciate the continued support from the community. Safety continues to be a top priority for us, for patients and our staff. We have several measures in place. I'm not going to repeat them all this week again, but there is one new one that we have added for staff, and that is for all staff that are involved in patient contact, that they'll also be wearing a face shield. So even if someone's walking down the hall, you'll see staff wearing face shields in addition to their face masks. All other safety measures that we've listed in the past are still in place. We still are under visitor restrictions. We have put in place an option for virtual visits for patients admitted to the floor, and we've also added room numbers to the outside of the window or the external windows for family members or friends who would like to see their loved one in the hospital. We'll continue to evaluate, and we'll continue to look at all the situations that are going on and the recommendations that are coming out, and we'll continue to implement those as we get that information. As far as testing update, as we mentioned in the past, at this point, we have had a total of 100 tests. Total positive were 4. Total negatives were 93, and the total pending are 3. And those numbers include all of our patients, which could come from outside of the county area. And we do post those on our website, that you can check that if you like. We have approximately 125 to 140 test kits available for patients today. We've been asked a couple questions about preparedness and plans, and some of the questions I think I can answer and share with. Some of it is, I can't share a lot of detail, but I've been asked about what kind of models that are being used. The most common one I think is being used by hospitals is the University of Washington's model. And they, in conjunction with the Institute of Health Matrix and Evaluation, they have a great website that provides a lot of modeling. But just to be fair, and when you look at modeling, they're good to a certain point. If a model has a variation that is too wide, it's really hard to pinpoint and use the data. So some of that is in this model also. The projected peak is estimated to be really the very end of April or the beginning of May in that timeline, and I think we're still on track for that. The hospital has plans to add additional beds, but that would be housed in the hospital. We have approximately 20 beds that would work, and we do have identified places where we would put them in the event that we needed additional beds to our 25 that we have today. In addition to that, we are coordinating with regional hospitals on how to take care of and handle surge in any one region if there is a need. So we are working with our region, which is southeast Iowa. It goes up above Iowa City and includes Quad Cities, to expand and tap into that regional resources if there is a need for surges. So Brett, touched on the PPE. We do at this point, in working with emergency management and working with our normal routine vendors, have in the community donations, which we really appreciate, have been able to stay up with the demand of PPE at this point. As you can imagine, though, is if there's additional cases, that means additional utilization of PPE, And so there will be, the gowns that are being made, we really appreciate the work in that area. And then the final, we'd encourage you to continue to stay home when it's possible. Practice social distancing when you have the opportunity. When you do have to be out, practice good hand hygiene, and to call the hospital before you coming in so we can help prepare and identify how we can best serve you. Thank you.
Hello, I'm James Trent. I'm the medical director for Jefferson County Public Health. I don't know if I have a whole lot to reiterate this week. There's some things I would underscore here. But as far as in the recent press conference this morning with the governor, you may hear about one of the regions now being put under what would be considerably a shelter-in-place type order. So as has been previously mentioned by Chris, we have different regions within the state. And in these regions, they're given a score, and if the score goes above a certain amount, then that region would be considered needing to have a shelter-in-place order. And so I thought I might discuss that a little bit. As Region 6, which is just north of us, which would include Lynn County and Cedar Rapids area, was now just this morning having to be put into a shelter-in-place type order. And so the scoring, you might wonder about what goes into that. I won't get into a lot of detail about that. However, there are four really major criteria for this, which are the percent of the population is greater than 65 years of age, the percent of identified cases of COVID that are hospitalized, and then the infection rate per 100,000 people in the region over the past 14 days. And then finally, the number of outbreaks in a long-term care facility. Now, obviously, the long-term care facilities are at great risk of developing COVID with the number of residents under close quarters or closer quarters, and have been, unfortunately, areas of great morbidity, meaning illness being had, and mortality as well, where patients would potentially succumb to the disease. And so these long-term care facilities are under a great risk of developing a lot of illness as well as death, potentially if COVID gets widespread in these facilities. And so judging by these four areas, each of these are assigned a scale of 0 to 3, and therefore it's on a scale of 0 to 12 that the region is assigned. And so our region, which is Region 5, as Chris had mentioned, has a score of 9 currently. Region 6, which had been placed under a shelter-in-place order as of today, for the next till the end of the month, had just reached a score of 10. So anything from a 10 or above is what triggers the state to say, hey, we need to put a shelter in place for this particular region. So we are at a 9, so we're sort of at the border there, sorry. And so at that cusp, it really behooves us to be better or improve or do whatever we can to help mitigate what we can. And as Chris said, really the virus kind of dictates what's going on here, but we can do our best to try and mitigate as best as we can with social distancing, as Bryan's mentioned, washing our hands, and might underscore, again, only going out at essential times for things that you need, trying to limit things to maybe once a week for your shopping or doing other essential errands, getting gas, etc. And so those kinds of things that you can do to help intervene with any sort of mitigation of the virus spread would be greatly help, because as we have been told to limit our outings and such, when you hit a region or when you hit a score such as 10 or higher, then it becomes the state will step in more in terms of what really can be done. And so try to do your best to try to mitigate as you can. You think that maybe staying home is not that great or much of an effect on what's going on here with the current epidemic, but it really does. And if you do your part, we can hopefully minimize whatever risk there is. But also take time, as I mentioned last week, to find ways to help others that may not be able to help themselves as often. Say the elderly or somebody that might need help getting their shopping done, that would be at risk if they were to be out. Again, there's others that are out there that have a lot of underlying health problems with their lungs or their heart or their kidneys, that would be at risk for going out in the public and exposing themselves to others that might not be, or that may not be, if they were exposed, I should say, that they would potentially become ill and potentially seriously ill. So again, do your best. We appreciate your efforts for doing what you can. Take time to also for self-renewal, as you were, with exercise and other things that would help with your mental status. It's hard to be cooped up like this at times, and so things that you can do to help your own mental health will go a long distance as we go through this time. As Chris has alluded to, there's not a timetable to this. We can't say by X date this is going to be over with, but if we do our part now, hopefully we will be able to get through this in a timely manner, but hopefully we also be able to keep people safe and from developing serious illness. Thank you.
Good morning. I'm Darren Hamilton with the Jefferson County Board of Supervisors. We really don't have a lot to update as far as the virus is concerned, but as with all things, normal business is going to continue with our road projects that are coming up. We have $6.7 million worth of road improvements that are going to be done this summer, and our contractor has told us that they should be beginning on a lot of the resurfacing coming up next week. We have predictions of 58 degrees coming this Saturday after our snowstorm tonight and tomorrow. So we should be moving into a time period where we'll be able to work on the roadways and get our projects completed that are coming up. We also want to confirm that we are supporting our public health and EMA staff as much as we possibly can, and we are very appreciative of the work that they're doing, not only for the county, but the citizens of all of our communities here in Jefferson County. Thank you.
Just when you thought I was done, I'm not done. I have a couple things that, I got a couple text messages actually while I was listening to everybody else. Tammy, one of the nurses at the health department, just sent a text to me, and the cut fabric is now arrived at Jefferson County Public Health at 200 West Briggs. And Connie made some copies of the little directions, so that's available. Just a reminder for our hours, we're open from 7:30 to 4. The door is locked, but just call the phone number 472-5929. Let us know you're out at the door and we'll let you in. So we appreciate all of that. A couple other things. I just want to make sure that everybody understands when we're referencing the PPE shortage, personal protective equipment shortage, there was actually an order written by the Director of Public Health, Garrett Claybaugh, and it's got specific directions on personal protective use when it's in short supply. So I think I put that on a Facebook post, or I can email it, or I can send it back out today. It just identifies some differences in what frontline staff will be doing during that shortage. I don't want to get into testing a lot because you're going to hear all sorts of comments and statements, rapid testing, antibodies, we didn't get a test, we did get a test, it was negative. Here's the deal. At the end of the day, as public health, as providers, as practitioners, we are going to treat you according to your symptoms of this illness. So I can't stress this enough for individuals to not get so hung up on a positive or negative test or access to a test. If you're doing okay, if you have some symptoms and you're doing okay, stay home. Talk to your employer on the phone. Keep your kids home. Keep them safe. Do what you need to do. And try not to get so focused on a point in time snapshot of what is going on. I feel like the teacher on the Peanuts cartoon, you know, when you're standing there going, rah, rah, rah. It feels like I say the same thing, but I just can't stress that enough. If you watch the media, national media, especially international media, it's it's brutal, and it makes it really difficult for us in a small rural setting when we're not a hotspot. So try not to get focused on that. I do want to give a shout out to our local media, Classic 96. I'm on the radio station a lot with Steve and those guys over there at KMCD, Andy from the union, all of our local media folks. I know that KYOU was up and did a gown segment with Dee and Connie. So if it wasn't for our local media, we wouldn't be able to get the information out. So I really, really appreciate everything that they do for us. And you can follow all of us on Facebook. I think I put that on the Health Center, the City of Fairfield, EMA, Public Health. We do know that the governor is going to be addressing the school closure issue again. I don't have her timeline, but I think it's by the end of this week, if I remember. Tomorrow is the end of the week. I know we reference days, and it's like they just all blend together. Again, I just want to thank everybody in our community for doing what they've been doing. And just know that public health is not the police. All we can do is ask you to do the right thing and to be respectful of other people when you see them in the store and to try to give somebody that 6 feet of space. So with that, I'm going to turn it back over to Connie. If you guys have any questions, you know how to get a hold of us at the health department. And thanks, Connie.
I think that's it. We don't have any questions online. I guess I, again, want to remind people they can donate towards the gowns, cash, or if you actually want to donate material, our request is that it be 60 inches wide. That's the preference. If it's 42, 43, that's fine. The 36-inch material is a little bit too short. We'll take it if that's what you have, but preferably it's 60 inches wide. So again, thank you to all our partners today. Really appreciate you coming in. And we can't say enough thank yous to all the people sewing and all the people who are working that throughout our businesses. And we just really appreciate the attention you're putting on this. Again, continue to wear your masks in the public. Could certainly see a few more when we go to the grocery store. Appreciate your participation in that. And we'll see you next week. Thank you.